video, I will give you the best explanation of why you're stuck with back pain. That's the explanation that I wish I would receive when I was dealing with back pain 7 years ago. And that's the explanation I'm, as a physiotherapist, now giving to my clients so that they better understand how they got there and how to get actually out of this cycle of ongoing back pain. So there we have it. That's the graph that you need to memorize, remember, because it will just explain why we are here, where we are, and why the treatments, as they are suggested from doctors, from conventional health system, are not the solution for back pain. So everyone is having a level of load tolerance. That's basically your back tolerance, how much load your back can take before it gets injured. So this level of load tolerance, well, it's slowly decreasing with time as we stop using our body in the way how we're supposed to use, when we start spending a lot of time in this position, when we stop going down in a deep squat, when we stop using our joints in full range of motion, our level of tolerance is slowly decreasing. Well, to this point that normal activities such as brushing your teeth, bending down to the sink, or picking a normal object from the floor is suddenly causing you an acute low back pain episode. Well, what you do? You go to the doctor, you seek support, and usually the doctor's advice in 90% is to rest. Maybe they send you to MRI, maybe they give you also advice to go to physio or to chiropractor, but usually it's combined with rest. You need to understand that every tissue in our body is going to adapt to the stimulus. So you know, in the nature everything works by this principle: if you don't use it, you lose it. So when we rest, when we stop using our body, our spine, our muscles, our joints in the way how they supposed to be used, well, we are of course losing this capacity even further. And I like to call this phase here a honeymoon phase. Why? Because of course we decrease, that's basically all our loads, right? We decrease our loads, we lay on the sofa more, we stop going to the gym, we are afraid of even thinking about going to the gym. We are afraid of rounding our spine down, so we do everything with a straight back. We never round our back anymore. And yes, you probably in this phase don't have a back pain, or the back pain reduced. So you think that you are healed, that you are already at the stage where you can return back to your old activities. And that's what happens. Now we are dealing with very, very limited load tolerance over here. And suddenly, of course, we want to return back. Maybe we don't even do anything different. We pick our kid or our dog from the floor and we get another episode of acute low back pain. Usually at this point, with 90% of people, the cycle repeats. We go again to the doctor as they really don't know what to recommend us. They give us painkillers at this time, maybe some corticosteroid injections, which give us again this false feeling of relief. But once again, I'm gonna ask you, how long does this relief actually last? Is there still a fear behind your mind telling you to stop the movement, to not go there, to not go in certain position? If the answer is yes, you haven't addressed your limitation. The problem of all this graph is that no one in the whole picture of this back pain cycle that can last for years ever asked God, how does your body move? Can you squat in front of me? Can you hinge? Can you show me how is your hip and thoracic spine mobility? No one ever did any assessment, any test with us. And they simply relied on passive treatments, something that's gonna fix the symptoms, but never the root cause. So my friend, the solution to all of that is, first of all, to find someone who's gonna do a full body assessment with you, full body scan, someone who's gonna assess your mobility of your hips, thoracic spine, your ankles, how your body moves when you bend down, when you hip hinge, when you squat, and also to assess your core stability, your spinal control. If there is a weak link in whole this chain, and that could be your ankles, it could be far away from your low back, it's gonna definitely affect, and no matter to how many treatments or physiotherapists or chiropractors you do, the pain will keep coming back. So that's the first thing, doing movement analysis, knowing where exactly is the problem in your body. Second step is working on your strength and mobility. That's usually a very neglected aspect in the whole conventional therapy of treating back pain because people don't know how to tackle it. They think that the training is the cause of the back pain, but actually it's the solution. If we start training in the right way, if we pick the right movements, if we regress the exercise to the level that is suitable for you. A lot of people are afraid, or doctors are afraid to recommend because they don't know how to regress, and they rather suggest to rest. So it's very important that at this point, when you have a back pain, yes, you do take time to decompress your spine, a way that the acute symptoms slowly fade away by having the right techniques, the right decompression positions, and then as soon as possible start working on strengthening, on mobilizing your spine, your hips, your thoracic spine, to the point that you can get back to activities you used to love without being afraid. Can I do that? Because as long as you're gonna be afraid, you're gonna avoid certain things so that you don't feel the fear or that you don't feel the pain. But my friend, the avoidance is not the solution. If we injured ourselves, if my client has injured by doing deadlifts, what I'm gonna do, I'm gonna make sure that I get this client toward the point that we are doing deadlifts again, because that was the point of injury. That's where the tissue got contracted, and that's where the trauma happened on physiological level and also on emotional level. Our mind perceives certain movement, either bending down spine, as dangerous movement. So we need to reverse this whole process of trauma, start from the bottom, which obviously requires someone who has a knowledge of what to do, what movements, how to progress them, someone to follow you and give you the right set of tools and also guidance once you're on this journey, which is obviously going to be unique for every single one. So if that made a whole lot of sense, if you finally understood where you currently are on this cycle, maybe you are somewhere here and luckily having enough still capacity and you're noticing that it's slowly going down, but you still don't have a pain and you're just aware and watching this video, by raising your awareness and proactively doing, then congrats. But maybe you're somewhere here, maybe you had a back pain and now you're in this cycle of physios and getting slight relief, but again getting a pain again, and you want to do something. So if that's you, then I want you to schedule a free consultation with me, because I would be more than happy to hear more about back pain, understand, perform a few tests, and then based on that see if my program is also a good fit, or if I can just at least point you in the right direction or help you with some tips or guidance. So hopefully that's clear. Please don't forget to subscribe to my channel, because I'm about to share a whole lot more of those kind of videos where I'm sharing with you my 8 years of experience dealing with my own back pain, and also my experience as a physiotherapist of helping over 200 of my clients get rid of this problem forever.